Welcome. Come with me. The doctors will see you now.
Well, welcome back to another episode of Fast Talks with Family Docs. I'm Dr. Phil Palmer.
And I'm Dr. Veer Vidala. We're back with Dr. Sacket here again. We've been talking about all things free clinics and the safety net of how we're helping the underserved population in Oklahoma. Dr. Sacket, so my experience, like you mentioned, with free clinics is mostly as a student and then as a resident. I went to KU in Wichita, and they had a JDoc clinic too. That kind of, I think, a lot of the medical schools and residencies are kind of establishing, where it's like a student-run clinic with attendings coming in supervising.
Right.
But in my experience, there's usually a family doc that's kind of like, taking the helm of the primary care aspect, and then we would have specialties come in one day and then see patients, right? Do you think your training as a family physician or family docs in general, do you think they're uniquely situated in a position to where supervising or caring for a free clinic is like in a setting where your training helped you get into that role, maybe?
I really think it did. I mean, from just analyzing family dynamics, looking at how there are support systems in place, those kinds of things that we do as a family doctor to kind of figure out how can we help people with the support they have. And that was really huge for me, I think, to start looking at that, the depth of the scope that we had to learn. I mean, there was a lot of times whenever I had to learn some things or relearn some things that I didn't do as frequently, whenever I have a specialist ready to call in my back pocket that's not there.
Right.
So we did a lot of, for instance, I learned a lot more about hyperthyroidism treatment medically because I was used to sending a lot of folks to endocrine or hepatitis C. We saw a lot of folks with hepatitis C, and in those early days of the newer medications that could actually treat it, like Harvoni, Epclusa, I had to learn all about that. And we actually developed a protocol to be able to get the medications for these folks that are, several $1,000s of treatment that we could get for people, and we're curing hepatitis C in these patient populations, and they were just the most grateful people ever that we could provide that for folks. And that protocol was one of the things we were really proud of at the clinic to be able to provide those resources. But all that came from just, taking what we had and learning to work with what we had. And I think as family doctors and the training we have, I think we're uniquely positioned, honestly, to take what we can from all the different disciplines that we spend time with and rotate with, and then work to find that way that's going to take care of a person, and not just their health physically, but their mental, social, spiritual, all those aspects. And I think that family docs do that very well. And that's one of the things I was really happy to see us do and do well, and then try to push that out to the students that we had, help them see that that's what family medicine is really about in the end, is that it's helping the whole person in all of their various facets and not just something specific.
Look at the patient as a whole. And I feel like that's something that we see in this podcast from returning guests, or every guest, is that there's a need in the community, family docs rise up to fill that void.
Right,
and
absolutely.
it's really inspiring to see.
For sure.
That's
for
cool.
sure. Steve, you mentioned, and Vera mentioned just a moment ago, about the engagement that a lot of people have with free clinics, that it may happen not only pre-medical school, but in medical school and in residency. And the same happens with nursing students. So how does a free clinic engage with those learners? How does that dynamic get set up? And what do you see as the value for learners engaging in a free clinic as part of that process of their education?
Gotcha. Yeah. There are various relationships that we'd have with some of the schools. They would send people in. We would have, things set up where they would send folks, residents, for instance, like from the Great Plains Clinic would come through, and I got to meet a lot of the residents, even after I left residency, that would come through and have their time to be able to do that. And we would plug them in basically like doctors. They would see patients. They would report to me. I would be functioning as an attending essentially for them, where they could report to me, and we would just talk about the case and that kind of stuff from that level. From the medical student level, a lot of it was similar to a clerkship, where we would just let them take histories, take vital signs, report back to one of us about the patient, and then talk a bit about the plan. and do those things. With pre-med students, it was very similar.
Yeah.
We got a lot more longitudinal help with the pre-med because they could be there more. I mean, med students could come when they could, and residents were there for the rotation or for those days when they were there assigned to come. But we got a lot of that with the pre-med. And so a lot of those students actually ended up coming just because they took fire. They got that fire like I did whenever I was a pre-med student to help people and to be a part of it. And they became part of the staff almost. And so it was really fun for me to be able to then watch them take that next step. And I got to kind of pay forward what Dr. Hall did for me, writing letters of recommendation and all of those things for some of those folks, and to see what they've done and kind of follow them on social media and what all they've done now is just, it's fun. It's like a proud parent. I mean, as an attending, I'm sure you see that a lot. And that was part of the fun, I think, as being, taking those students, watching them grow, and then seeing how their skills would develop and how they could flourish in terms of talking to people, going from being really shy about how they would talk to somebody and just getting that experience, getting more comfortable. And I know, at least for me, I could see them attaching ideas to a patient. So something that they learned or something they were going through, having that patient that they could attach that to and say, that helps me remember because I saw a patient that had that problem. And that's just another way that people would learn. And getting to watch that happen was very satisfying. And an important part, I think, of a lot of the medical, those free clinic settings is to have those students be a part of that and to help out, especially when we are sometimes understaffed and don't have the people we need. Some of them rely on the students even more, you know?
Yes, and I know it's been discussed at the statewide level as well as the national level that to draw people into family medicine, we can't just start recruiting when they're in medical school. That we've got to make connections when they're in college. And honestly, people are saying now it's really at the high school and perhaps even in the junior high level to connect people and help them understand that medicine is something that they can pursue, that it's not out of reach, that they can make a difference in their community and in their state and in the world. And I think certainly having an opportunity for them to go to a free clinic and work with great family docs to get that connection with medicine and to learn how to engage in making a difference in people's lives is a wonderful opportunity.
Yeah, I think it goes starting that young and going, beyond going into medicine for quote unquote clout, right? That feeling of what serving actually feels like that young, because I know some high school kids now through my own like church or temple, and they're already volunteering at Monosuntos, and I was so proud of them. They come back and shadow me, and they're like, "Oh yeah, we already know how to do vitals. We did this at Monosuntos."
There you go. That's amazing.
It's great.
I love that. Love it.
So, sir, I think we mentioned like a lot of our work that we did in our training, or the work that we do in our careers, kind of shapes who we become as a physician. Would you say your work with the free clinics kind of molded in how you address and see patients now in your private practice?
Definitely. I mean, it was always my goal to have some type of contact or figure out what is my mission outside of just being a family doctor in a private practice. And a lot of that, at least in the early days, I always thought was going somewhere to be a missionary, going somewhere to spend a week or two in another country helping out. And I did some of that in medical school and in residency. But to be able to do it in my backyard, where it's something that could become something I could do regularly and could be just another aspect of my practice, another aspect of who I am, to take that compassion that I have for people and to be able to apply it to folks who just wouldn't have the means otherwise. I think it built my empathy. It definitely built more compassion for folks who just don't have the resources. I think it's inspired a lot of creativity for me in my own practice now, whenever I have folks like that, to just say, where can we find the resources? What can we do? Mercy, where I work now, has a big heart for that too. And they have, the Mercy Sisters Fund that they do a lot of work for folks who don't have insurance, and they can apply for that. And so when I have those patients, it just takes me right back to those days whenever I was seeing patients at Open Arms, and I'm like getting in with them and figuring out, how can we help? What can we do? Where are those resources, those things that I've learned about that then I can apply to my practice now because I had that experience. And that's, it's very fulfilling. It's very challenging. Like you said, a lot of the challenges in that patient population in terms of coming back for appointments, follow-ups. I mean, we would do as much as we could in a visit because we weren't sure that they were going to come back whenever they said they could come back, because they weren't sure if they could. They weren't sure if they'd be in town or if they had to go somewhere else. And all of that just really made me appreciate the patients that I have, the continuity of care that I've been able to have now, because I know that we don't always have that. And a lot of patients don't have that ability to just come back regularly with their doctor, that we kind of expect that we'll see them on a longitudinal basis, but that's not always taken for granted.
Yeah.
And I don't want to take that for granted.
It's not like we're almost like grateful for the resources we have in some of our patient population.
It really makes a difference.
It does.
It makes you
really
feel like,
does.
wow, we really do have resources, and in some cases spoiled more than we thought we
Yeah,
were.
exactly.
Well, Steve, I have one final question for you. Just kind of from a high-level view, if any of our listeners or viewers are interested in whether it's through connecting in a free clinic or whether it's through their own practice that they may have right now, and they're interested in engaging the vulnerable population in their area, thoughts, perspectives that you might encourage them with to connect in meeting the healthcare needs of a vulnerable population?
A lot of it just starts with finding out what your resources are and what's available. There's a lot available within some systems that you may already be a part of and not realize. I mean, thanks to my efforts with Open Arms, I'm aware of some of the clinics, like the ones that are affiliated with Integris, for instance, or the Good Samaritan Clinic at Mercy. And they're always looking for folks that could be volunteers, that could help out and could do those things. And so some of it's just finding out within your own system where there are some places you can plug in. A lot of churches are aware of those resources too, and could find places to plug in also. I'm sure there are some national organizations that I didn't even know existed that actually have directories and resources. And once I got into it, I realized that there's the National Association of Free and Charitable Clinics. They have a website. The Christian-based clinics have their own association also. It's called CCHF. I don't even remember what it stands for exactly, but we went to some of those meetings, and I know that there's a lot of students that will look at those places to find ways that they can plug in. They can find internships that aren't even necessarily here in Oklahoma that give them a chance to kind of go and find something to do maybe in a summer when they have some time off that they want to volunteer, and maybe go someplace and check someplace else out and just kind of see how other folks do it. But there are definitely those kinds of resources that are available if someone's looking to see how they can plug in.
Yeah. Outstanding. Well, thanks again for your time and joining us and sharing your experiences. A fascinating story, and love learning about what you've been able to do as a family doc. Veer, great seeing you again.
Always a pleasure,
as
sir.
Always. And listeners and viewers, we'll see you next time on Fast Talks with Family Docs.
Thank you for joining us today. The doctors would like to see you back for another check-in. Please choose to follow our podcast, and you will automatically be notified when it's time for your next appointment.